Good morning and welcome to another episode of Doc Talk. Today I will talk about plastic surgery or cosmetic surgery, which was some time ago considered as a taboo in India. Nobody would like to talk about correction in their features. There was a time when being beautiful or presentable was the onus on the female. It's no more the same. Even the male are supposed to be very presentable, fit and scratch-free. That is the reason why cosmetic surgery and plastic surgery, as we know today, is gaining importance, and that too with younger generation. Now when I talk about younger generation, this is not exactly what I mean. Now younger generation means people who have passed their young age but still want to look young, and cosmetic surgery is the answer to that. Today I am joined by one of the leading cosmetic and plastic surgeon in Jaipur, Dr. Varsha Mahadeo. She has done her MCH, that's super specialization in plastic surgery, from B.N. Nair Hospital and Medical College, Mumbai. She has experience of more than 7 years in performing all kind of cosmetic surgeries, mainly including rhinoplasty, breast augmentation, breast reduction, then blepharoplasty, rhinoplasty, and she has hands-on experience in hair transplant as well. We'll talk about various procedures that are being done at Metro Hospital where she is working right now, that's located in Mansarovar area of Jaipur, and we'll understand what kind of patients she gets and how are the results in cosmetic surgery these days. Let's welcome Dr. Varsha Mahadeo, plastic surgeon at Metro Hospital, Jaipur. Good morning, ma'am. Now let's come on some serious topics. We have spoken about the beautification procedures. On the reconstructive side, are we handling burn cases here?
Yes.
What percentage? Till what percentage can we handle the burn?
So we can handle any amount patients, but how much result we'll get is like you get a good result up to 50%.
50% burn we can handle over here?
Yes, up to 50%. But more than that becomes difficult. You need a entirely separate burns unit. That right now we don't have it.
But still at least 50% if it can be handled. Just for our audience sake, I would like to tell them that most of the hospitals would reject a patient more than 30% of the burn. Metro Mass Hospital in Jaipur, just Dr. Varsha Mahadeo told us that they can handle more than 50% burn, till 50%, 50% of the burn percentage. And so apart from handling them, do we do the reconstructive part as well?
Yes, of course.
Okay. And so what kind, are you doing a graft system?
See, what is nowadays in the plastic surgery is regarding breast, burns reconstruction is splint technique. So we are preferring those techniques to avoid the patient post-op recurrence of the contract, to avoid the recurrence of the contracture. We give them flaps in between, we do multiple sedplasties and VY-plasties so that patient don't recur with the contracture.
Okay, what other reconstructive procedures we do here in terms of trauma?
We are doing all the kinds of flaps, lower limb trauma flaps, and facial-maxillary trauma, including the facial-maxillary fractures we are managing. And
do we do some birthmark removal? Like there are patients who come with that they have an inch of black mark on their face. So is it done over here through plastic surgery?
Whichever of them need surgery.
So how we decide? Because most of the doctors would say that it is done by laser. Plastic surgery is not effective in this.
It is not like that. It is that if there are different kinds of nevus, for example. So if it is like Portman stain, then those can be managed with lasers. If it is a giant hairy nevus that needs surgery, so we go ahead with surgery. Tissue expanders, we are placing it regularly.
So is there a scar left after the surgery?
You cannot be a scarless with surgery. You can have a good scar or a bad scar.
Okay,
and we are the person who give good scars.
Okay, and it goes with the time?
It decreases or mixes with the rest of the recurrence.
But it will remain.
Yes.
Slightly it will remain.
Yes.
It won't go, but it would be definitely better than a mark that you have on the face. Okay. Thank you, Dr. Varsha. It was nice talking to you. We had so much information about plastic surgery, cosmetic surgery, Thanks.
Thank you.
So this was Dr. Varsha Mahadeo talking to us about the plastic surgery and cosmetic surgery procedures that are being done at Metro Mass Hospital, Jaipur. She also spoke about the various reconstructive procedures. Metro Mass Hospital is one of the most advanced trauma centers in Jaipur right now, with a team of neurosurgeon, orthosurgeon, abdominal surgeon and a plastic surgeon. This makes this hospital one of the most preferred trauma centers whenever it comes to multiple trauma, facial trauma, maxillofacial trauma, or anything in terms of injuries. So this was Dr. Varsha Mahadeo talking to us on plastic and cosmetic surgery. It was great experience talking to her. Hopefully this will relieve our audience out of some myths, the myths that have been busted by Dr. Varsha. Thank you so much, Dr. Varsha, for your time. Thanks so much.